So could you tell me a bit about the charity then, your organisation? When did you set it up?
It was registered in December 2021. So
Oh,
it's
so
been
very
just
new.
4 months. Yeah,
Oh,
it's a
very
very new
new.
organization, and I'm working on mental health awareness as a champion, because people here don't know about the mental health is a disease.
Okay.
They just know that physical health is only a disease that can be cured. Mental health doesn't exist. So
Right.
I basically go to the places in rural areas from Kathmandu Valley, and give them the orientation program, make people feel that mental health is the main cause that will lead to depression, frustration, anxiety, and we can't think of any other thing, and we want to do suicide activities or take drugs. So I make people aware that mental health should be concerned and you should treat it.
Okay. So
basically, I am doing this orientation program to women community and students of bachelor level, +2 level, because they are more, after this COVID, they are more prone to depression and anxiety.
okay. And do people recognise that what they're feeling has got a diagnosis? It is anxiety or it is depression?
Yeah, after my orientation program, they feel that, yes, I'm also suffering from depression. So what should I do? How should I get out of this depression? And they consult me, and I give them the advice of yoga, meditation, and this medicine is the last steps you can take if there is no any other solution to get out of the depressions.
Okay. And do you mind me asking, have you had your own experiences of anxiety? Is that what's led to you doing this?
Actually, I'm just working on mental health so that people can live their life happily. I don't want people to live their life in anxiety and in sadness, in depressions. And as far as possible, I give them the advice, I give them the orientation program, and moreover, I focus on rural area because people are very deprived of educations, knowledge. So I want them to live a happy life with dignity.
Yeah. And are you a charity? So are you registered charity? So how are you?
We are a registered organization. We call it here an organization, non-government organization. It's a non-profit organization. We haven't done any charity program to raise the fund, but we are working on our regular fees that our members put in this organization as a yearly fee. So we are working with that amount in this orientation program, counseling program.
Okay. So people pay you to be a member of the organization, is that?
Yeah. We have 9 members, and they just give me their yearly membership fee. So we are working with them, and the traveling cost and everything is in our own expenses.
Okay. And do you work with men and women when you do the orientation programs, or is it just women? Or
since it's an initial phase, so we are working with women and children, adolescents, should I say.
Yeah, okay. And what difference have you seen since you've been doing this work? Have you seen it making a difference?
Yeah, people are very much kind to me, that they never knew that they are living a anxiety life, they are living a fearful life. So they feel that they are, after my orientation program or counseling, they feel that they can change their life and live happily. So their face and their gesture seems so proud, make me so proud.
Yeah. And you have some people helping you as part of the team, don't you? I looked on your website, and there's three ladies that work with you. Is that right?
Yeah, they are my members.
Oh,
they are my members.
Yeah.
Yeah, they are from different background. They are from social. Some are from the science background. One is a doctor, so they work with me. We also hire a professional counselor
Okay. Yeah.
and make a program in this capital city also.
Yeah. Brilliant. So how do people in Kathmandu access your help then? So you go out to the rural communities, and then how does it work in the city?
Yeah, in city area, people after this COVID, people are aware about the mental health issues. The counseling, the psychiatrist, should I say, the psychiatrists are in more demand nowadays, because people are aware that mental health is a serious issue and that can be cured. So in Kathmandu Valley, there is no any such primitive issues that we should go and orient about the mental health in capital city. That's why I work for outside valley, or should I say in rural areas, where there is a very need of people who want to live a happy life. I think they might be living a anxious and fearful life since after their marriage, I guess. So 15 years, 20 years, 30 years, they are living a fearful life. So I feel so much helpless seeing them, and just it empowered me to give more program to such people.
Yeah, brilliant. So how does the healthcare system work in Nepal? Do you have health insurance? Do you have to pay for psychiatrists?
Basically, the health insurance is implemented in city area only.
Okay. So if somebody wanted some help from a psychiatrist from a rural area, would they have to pay for that themselves, or would they?
Yeah, they have to pay for themselves, and they have to come to Kathmandu city, or very organized, very urban city. Rural area don't have any medical facility for mental health insurance. Yeah.
Okay. So they would have to come to the city to be able to access that help.
Yeah.
Yeah.
But in context of Nepal, I should say, basically in rural area, people find having a mental health is a side thing. They don't express, they don't say that I'm going to depression, I'm living an anxiety life. They don't share, I am having a trouble in sleeping. They don't share these things because they think that people will laugh, they will not understand, they will think he or she has gone mad. So they don't share about their mental health. They just keep it with themselves and live with it.
Right. That's such a shame, isn't it? Because a lot of people would be helped if they were able to talk about it. Do you wish that it could be more like it is in the West, like it is in, in Western countries, where we talk about it a lot more and there's more help available? Do you wish it could be more like that in Nepal?
Yeah, I think like a physical health, people should also focus on mental health, and the government should also impose certain package, certain rules, certain donation or fund to mental health also. But they don't give any priority for mental health.
Yeah. And are there any other organizations doing what you do in Nepal?
Yeah, I guess there are maybe 6 organizations who are working with mental health, and I haven't detailed study about them. Two organization I can say that TPO Nepal and COSIS is very actively participate in this and mental health issues.
Okay. And how did you come across Anxiety UK? How has this partnership come about?
Actually, I said I just register my organization and just willing a help of training from any organization that they can provide us the training, and I can implement the knowledge to the people where I can go and give a training. So I just emailed to 22 organization in a day and in a 22 organization I just got reply from 2 organizations, that is Anxiety UK and another one is from Netherlands. So I'm working with both of you right now.
Okay. And is Nikki giving you advice on how to run the organization and how to help people? What help are you getting? Yeah.
It's just to give me the positive impact that I can gain more knowledge about the anxiety or depression, or should I say mental health, and I can share my knowledge to people in the rural areas.
Okay. So what are you looking forward to most about being part of the Anxiety UK Global Alliance?
It will be all my pleasure to work with you and your organization. CEO is also organizing a training program for us. So we are just looking forward for a date and email so that we can be a part of Anxiety UK and work it in a long way.